Hi, this is Dr. Abraham Perumala. I'm a licensed physical therapist, specialist in musculoskeletal conditions. Mr. Neeraj was suffering with severe knee pains in 6 months. He had tried multiple options. He went to a couple of doctors, and the further investigations were done. Later on, he was referred to a physical therapist by an orthopedic surgeon for a period of 15 days. So finally, he came to me and he has explained his problem, and he said, I need physical therapy for 15 days because after 15 days, I'll be going back to Germany. Then I have examined him with ABC posturological techniques. Then I said him very clearly that you don't need 15 days of physiotherapy. You don't need any equipment. It's only 2 or 3 sessions are needed to completely solve your problem. He was shocked, he was surprised, and he just wanted to give a try. Then examined him in detail with ABC posturological method, posturological assessment. Then I started to treat him, and within 2 sessions, there was drastic change. To more about him, watch this video.
I'm Neeraj, and I injured my knee around 6 months back. And then I went to a doctor who did an X ray and an MRI and said there's no structural problem with the knee. And he just asked me to basically rest my knee for a few weeks, and I thought that I'll feel better. But after a couple of months, I was still having pain when I was walking and even like climbing the stairs up and down. Then I went again to the doctor and he said, like, still did the X-ray one more time, and then he still didn't found any issue with the knee and said, okay, do a couple of more months of rest and it should be okay. But even after 5 months, I'm still feeling the pain. So I again had to book an appointment with an orthopedic doctor who again looked at my MRI and said, there might be an IT band issue with you. Again, there's no meniscus or any kind of injury to your knee, but there's like IT band syndrome that you have. And he recommended to do physiotherapy for 2 weeks every day. And recommended a bunch of exercises that the physiotherapist should be doing and using some like machines and everything. So then I just looked around physiotherapists and near my where I live, and I found a source of physiotherapy which was like had very good rating. So I called him up and asked him if he can visit me at my home. And he came and he examined my knee, and then he said, okay, I might need probably 2 to 3 sessions, which to my surprise was, I was like, the doctor said that I need 15 sessions. Why do you think that 2 3 session is fine? So he said, like, just trust me, go with the session and then you'll feel the difference. Okay. So then he, rather than working on my knee, actually started releasing some trigger points across my hip with his ABC method. And then after doing some of release of the trigger point, he asked me to walk again, and immediately I can feel less tension. I can walk a little bit more freely, and that was like really like surprising to me, and at the same time, like I was happy about it. And then again he said, okay, like next week, and I was like, can you come in 2 days? He's like, no, you don't need that, let me come in a week. And then the next session he again examined my knee a little bit more, and then he also realized that there's something maybe not aligning well with my ankle. So he again used his ABC method on my ankle and did some of his trickery, and then also released some of the tension that was on my hip. And then again asked me to walk again, and I can probably walk straight after a few months because I can feel my ankle is going the right direction, which it wasn't since the injury. So yeah, I was again surprised that I kind of recovered in 2 sessions just a week back. And yeah, I'm very happy with the result, and I would definitely recommend him and his method too.
Hope you have enjoyed the video. That's an amazing testimonial. We have treated him with ABC posturological techniques, with which there was very good change in 2 sessions. So initially, when I examined him, he came with a chronic pain in his knee. Then I understood that it's not this his knee which is causing him the pain, but it is from the hip. So I tried to focus on TFL, GM, and his iliacum. So that was the first session. Then I asked him to come for the second week. When he came for the second week, I have noticed that his walking pattern is completely changed. Then I asked him, so he said that I feel that when I walk, I feel that my leg is going in a wrong direction after the injury, which I'm unable to control. Then the information was given to his ankle. So instead of treating the knee, I was focusing on his ankle joint. The information was given to his ankle, and the ankle was corrected. Then his calf muscles were treated. Then immediately after the second session, his patella started to move very freely, and he feel that when he is trying to walk or when he is trying to squat, the pain is very, very minimal. So I'm going to teach him few exercises what he can do on his own that will really help him in the process of recovery or for the road to recovery. So we are introducing ABC posturological method, posturological assessment, posturological techniques on our clients to get a speedy recovery. And a special thanks to Dr. Guyan Pietro from Italy. Want appointment with us, immediately take your phone and dial the number or WhatsApp to us so that you can communicate with us and we can give a time so that you can come. You don't need to come regularly, as you have seen in the video. You need to come weekly once for 3 to 5 sessions based on the condition. But note, every patient is different, every patient is unique. You cannot expect the same result in each patient.